The family of a 44-year-old man in Edmonton is demanding answers after he died in an emergency room waiting area. They claim he went to the hospital with complaints of chest pain and collapsed after waiting for help for about 8 hours.
Is it recorded? So Prashant Shri Kumar complained of acute chest pain at 12 o'clock noon today. This is Monday, December 22nd, and he was brought to Graynans Hospital by 12:15, 12:20. He was sitting in the triage from 12:20 onward till about, I would say, 8:50 till about 8:50 in the night. He was sitting in the triage complaining of constant chest pain. His BP constantly kept on rising with the last recorded blood pressure of 210. He was taken inside. He was only prescribed Tylenol during the entire waiting time that he was outside, and he was not given help. They said that chest pain is not considered acute problem. They do not suspect a cardiac arrest. When he came inside, he was asked to sit down. He got up for fraction of seconds and he collapsed. He fainted, and the nurse was heard saying that I do not feel a pulse. So basically, the hospital administration, the employees of Graynans Hospital have basically killed my husband Prashant Shri Kumar by not providing him timely medical help. And the security was so rude that instead of addressing the cause, they said, ma'am, you are being very rude. So basically, it is okay for them to kill a human being and to tell the wife that you are being rude. Thank you. This is my statement, and I would want this to be taken to the court.
Canada needs to invest more money into their healthcare system, because what happened in Edmonton, bro, was sad, and it's, very unfortunate. A father at the age of 42 passed away at the hospital as he was waiting for 8 hours, that he was begging for help. And unfortunately, the doctors didn't really do much. Like, yes, our healthcare system is free, but I feel like the government needs to invest more money into it. Because number one, health is the most important thing in the world. And I already know what the internet comments are going to be, racist comments because they're Indian. Canada is a country with so much potential, but we got to invest in the right things, and we got to be better people in general. Rest in peace to that father, and condolences to the family. That's really sad what happened.
They said to my father-in-law that if Prashant would have come even 2 hours earlier, we could have saved him.
They admitted that had he been seen prior, they could have saved him, or what was the exact wording?
Yeah. Yes, it was the exact wording, and Dr. Miles refused this to be recorded. But I don't know if somebody had actually recorded or not. Don't quote me on that, Lisa, at that point in time. But we wanted to, and he refused to say anything while he was being recorded.
So then, did he bring you in to see Prashant, and is that where you made the recording? Explain to me what happened next, right after he told you that Prashant had passed.
I said I want to see him, and they took me to the room straight away. And that's when, I started pumping his heart, and I thought maybe, maybe he'll still come back. But by that time, he was already gone. By that time, all his friends and everybody had come, and I just wanted to be with him. I felt his body. It was so cold, like he had left me by that time. And that Dr. Miles was telling my father-in-law that here is my card, do what you can. Like nothing will ever happen to me because I'm protected by... because I'm protected by my insurance and AHS's insurance. I can't believe he's gone. I just feel that, there are still days to his funeral, Lisa. I just feel that, oh my God, can he just come back to me?
Yeah.
I'm just hoping that the Wednesday never comes and he comes before that.
Right, guys, welcome back once again to the channel. I hope you are having a great time wherever you are watching this episode from. And actually, it is so very sad that Canadians are dying on the waiting line, waiting for medical attention from a system that is telling them that medical or health care is free in Canada, but literally taking their lives. Yesterday, I posted a video of Canadians actually ranting about the broken healthcare system in Canada. Others were even confessing that if you want an MRI scan, you'll have to wait up to 80 days for you to get a scan. If you have a brain tumor, you'll have to wait for up to 3 years for you to get a surgery. Not to mention, if you need an emergency, you'll have to wait up to 20 hours for you to get services from these healthcare facilities in Canada, which the Canadian government is actually claiming it's free. Now, after posting that video, I saw a very sad and heartbreaking video of a man in Edmonton that a 44 years old died in the ER waiting room, waiting for doctors to attend to him because he had chest pains. He claimed he had chest pain. 8 hours later, he just passed on because actually no doctor was there to take care or to provide the medical attention that man died. And this video is going viral and breaking the internet. And actually, Canadians are fuming with rage and anger because they are saying this is exactly what happens, and the media doesn't want us to show, won't show us, but this is exactly what is happening to the healthcare system in Canada, and they are admitting that the healthcare system in Canada is literally broken. Let's watch these videos of Canadians ranting and commenting onto this incident, then we shall be sharing our opinions at the end.
So I'm in the abyss in between Christmas and New Year's. I know, like nobody, but I haven't really been on my phone, and I'm just following this crazy story of this 44-year-old man in Edmonton who went into the ER and waited 8 hours and died. And his wife, God love her, she did this video. She's standing over top of him, like he's passed away, and she got somebody to record everything that happened. And it's just like the story is grabbing the attention of so many, because so many people have had sort of a terrible experience with healthcare in Canada at some point. And you know, a lot of people are like, oh, this is the province's fault. This happened in Alberta, but the reality is people have died waiting in ERs in almost every province across this country. And healthcare is so broken in this country. Like, healthcare is what is supposed to define us as Canadians, and it's not working. And you know, I have so many people who work in healthcare in my family. They're burnt out. The helpers need help, and I don't care who you are, where you sit politically. This should outrage you. Like, this is something that needs to have a serious discussion. If I was the Prime Minister of Canada, I would call together all of the premiers and all of the health ministers in an emergency meeting, and I would address this. Like, there are solutions. Like, it's not working. And this is what is getting international attention right now. And Canada just keeps thinking, and we need leadership, and we need people to address the very thing that is supposed to make us Canadian, which is our health care.
Understanding why this is not national news right now. A man in Edmonton, Canada, 44-year-old Prashant Srikumar, who has lost his life, who was complaining of chest pain. Yes, you heard me right, in a hospital. So he leaves work. Him and his wife make it to the hospital. It's called Grey Nuns Community Hospital. 12:30, he's there. And he says, I have chest pain. They give him some Tylenol and said, you're fine. His last recorded blood pressure was at 210. He leaves behind 3 children, okay? His wife, brave wife, I should say, who complained, who made enough noise, and then security told her, ma'am, you're being disruptive. She was not taken seriously. Now, it takes a person, or takes a lost life to be taken seriously. I don't even know how she kept herself together. She recorded her statement. But how many more hospitals is this really going on in? And nobody talks about it. I remember going to a hospital in Canada. I'm from the States. Was there for about 8 hours. And I was pregnant. I was very sick, you know. And I didn't get seen for 8 hours. And I said, you know what? I think I better go home. And I did. But is this a norm of Canada? I hear all the time, oh, they have free healthcare. Yes. But is this what free healthcare looks like? You guys, leave me a comment. Tell me what you think. But right before Christmas, they lost her father. Ruby Bossy from Seattle, Washington will speak again.
We need to stop normalizing seeing people rolling around and writhing in pain on the floor, thinking it's an everyday situation. It is not. It is not normal. And we should not be walking by patients, whether they're writhing in pain, because we think it's normalized. A 44-year-old father is dead after an 8-hour wait in Edmonton ER. And as a nurse who understands emergency triage, I worked as a quality and patient safety specialist in the emergency department. Something is seriously wrong here. And I need not tell you, if you hear about anybody having a blood pressure in the 200s, you know something is wrong. Any combination whatsoever of cardiac features, hypertension, and pain warrants an ECG, blood work, and some form of medication, whether it's an ASA or nitroglycerin, because you know what? At the end of the day, giving those things don't cause harm. Further investigation. That's all that was needed. If he's telling people that his pain is a 15 out of 10, remember, pain is what the patient says it is. This is a systemic failure, and we have to ask harder questions about what is going on here and what actually occurred, because it is wrong. We should not have patients dying in this manner. And you know what? Let's talk about some of the racism that I've been seeing in some of these comments, and the fact that I don't even think the family has talked about racism being a factor, but I sure will. The Alberta Health Services System has already recognized that they have systemic bias and racism within their healthcare system. So it would not surprise me if race was a factor in the way that this individual was treated. So yes, let's look through the lens of negligence and discrimination. And you know what? We already know that the data is there. We know that racialized patients, especially South Asian and Black men, often have their cardiac symptoms dismissed or downplayed. When we other patients, we stop seeing the humanity and we only see a busy waiting room. Systemic racism kills people. His family has been shattered by the system that was supposed to protect them.
So I just finished writing and filming a video about the failures of our healthcare system here in Canada, and this happens. This is just so sad. A 44-year-old man in Edmonton is dead. He went to the hospital because he was experiencing severe and persistent chest pain, the kind of pain that we're repeatedly told to never ignore. The kind of symptom that every public health campaign says requires immediate and urgent medical attention. And yet, he waited. He waited for 8 hours to be seen by a doctor, and he never did. He died before receiving the care he went to the hospital seeking. This is what people mean when they talk about socialized healthcare failing in Canada. Not as a concept, but as a lived reality. Access that exists on paper, but not in practice. Care that depends on wait times and staffing shortages, and frankly luck, rather than urgency and need. This man had a family, people who loved him, people who expected him to come home that day. And instead, they're left with grief and questions that should never have to be asked. There is no excuse for this happening in Canada, not one. Not in a country that prides itself on universal care. Not when someone goes to the hospital with chest pain, one of the clearest medical red flags there is, and is ignored and denied care. We are so often told to be grateful for this system, that criticizing it is unkind or ungrateful, that it's better than the alternative. But I don't know if this man and so many others would agree. The truth is, silence about our country's failures doesn't save any lives. Turning away from the problem doesn't fix it. Accountability does. Our government and our health authorities need to answer some very serious questions, and their answers better not be about more funding. A young man is dead because a system meant to help him failed him on the most basic level. We should not accept this. We should not normalize this. And we should absolutely be outraged, because if this can happen to him, it can happen to anyone. And until we demand better, it will keep happening.
This is a tragedy just happened in Canada. So this 40-plus-year-old Indian gentleman went to the emergency department in Alberta health system. He waited for 8 hours. Before he can see a doctor at the A&E, he went there for chest pain. Before he can see an A&E doctor, he collapsed and he died from a heart attack. It's a tragedy because heart attack is solvable, is salvageable. In Singapore, this was unlikely to happen because if you go to any A&E in Singapore, you tell them I have chest pain. they would quickly do an ECG and call the doctor, because we in Singapore take chest pain very seriously at the emergency department. It is unlikely that you have chest pain, you get delayed for 8 hours. And anyway, even just a non-emergent condition, say a sprained ankle, you won't wait for 8 hours in Singapore. So we have a better system. So and for heart attack, they actually order this time called the door to balloon time. Door means the time you come to the A&E. Balloon means the time they put a balloon angioplasty, what they call a PCI, percutaneous coronary intervention. The door to balloon time, international standard, less than 90 minutes. In Singapore, about 90% of all our cases in all the hospitals can meet this standard. And in NUH, the rough time, the door to balloon time is only about 40 something minutes. So we did very well, at least in NUH. So a patient dying while waiting for doctor for heart attack in Singapore, very unlikely under the current system. Of course, if a queue in the hospital A&E become very long, we can't guarantee the future.
Alberta's healthcare system is broken. If you guys don't know already, this Monday on December 22nd, Prashant Shri Kumar, a 44-year-old, died at Grey Nuns Hospital after waiting for 8 hours to get emergency service. Now, I'm not gonna lie, this story hits especially close to home because I used to live in Millwoods and I used to frequent the Grey Nuns Hospital a lot when I was younger. So it's like just hearing this story feels kind of surreal because it's like, dude, I used to go to this hospital and now this is how they're treating people. And pretty much my bottom line on this story is that no one should have to wait 8 hours to get help. You know, especially considering the fact this guy was complaining about his chest pain, his blood pressure was 210, and he was literally on the floor begging for help. I mean, there's literally a direct quote from someone working at the front desk saying, oh yeah, you've been here for like 6.5 hours. You might have to wait a little bit more because that's the average waiting time. I just don't understand how in a first world country in Alberta, we've normalized these type of waiting times. I mean, at this point, it's undeniable that our healthcare system has been stretched thin. There's not enough nurses or doctors to address all of our patients. And then you got Karen McMillan, the chief operating officer at Covenant Healthcare, pretty much saying nothing is more important than the safety and health of their patients and staff. But I kind of find that hard to believe, you know, considering there is a person dead who should have not have died. If just one nurse gave Prashant the time and the attention that he needed to address his medical concerns, he would have still been alive. And I think this is unacceptable, that this is the state of healthcare in 2025. We got to do better, guys.
You know, something surely needs to be done to solve this problem, because when Canadians confess and tell us that that is actually what happens under the healthcare, it is literally a thing they are experiencing. And this man who died waiting for medical attention for over 8 hours is just one of the few Canadians, or one of the few people in Canada who are literally going through the same thing. But unfortunately, the Medicare or the healthcare system failed him, and he actually failed the family big time. You know, health is something very delicate, and health is something that should be taken very, very seriously. According to Canadians, the video that I posted yesterday, they are saying they are paying their taxes and 13% of their GDP goes to healthcare. And apparently, Canada is telling the world that healthcare in Canada is completely free. But what Canadians are saying is totally different from what Canada government is telling us. Yes, it is free, but it has a price to pay. Canadians are paying the price. Canadians are losing their lives in waiting lists, in waiting line. They are waiting up to hours so that they can get this free medical attention. Others were even confessing that instead of waiting, they opt to go to America and receive the healthcare. They'd rather pay top dollars there to get medical attention and save their lives instead of saving money to wait for a free medical attention that actually has got something to pay. And most of them were confessing that it is actually broken. This means that there is something wrong with the healthcare system in Canada that needs to be fixed. It can't be, yes, it is free, but at what cost? Yes, it is free, but is free meaning that it should take lives? What if that man got the required medical attention before the 8 hours wait? What if this man that died on the waiting line is just one of the most, or one of many Canadians who are going through the same things, but actually made it out alive? What if the doctors attended to him? We could have been speaking a different language. It is so sad, and condolences to the family and friends for the deceased. And apparently Canadians are totally heartbroken with this. As you can see, they are saying something surely needs to be done, and their reactions are literally genuine. And again, also others are saying it is just based on racism. Why was it not a Canadian, But we say in healthcare, there shouldn't be no room for racism in healthcare. I believe in healthcare, we should put humanity first. We should consider we are all human, and if we are human, we can bleed. Despite the race, we can feel pain and we can die. So racism does not matter when it comes to matters of healthcare. I think this is something that the world should literally know. It is so heartbreaking, guys, but surely something is broken somewhere and it needs to be fixed. Canadians, if you're watching this video, tell me what you think in the comments and let's have a discussion, because things are not pretty at all. Condolences to the family.